Welcome to a second ultrasound session featuring posterior vitreous detachment. We will demonstrate features of the posterior vitreous on ultrasound. Here we demonstrate the lacy, undulating and transparent sheet posterior to the lens and moving with eye movements, generally in the downward direction. Using the Juniper ultrasound, we will look at the axial view where the PVD positive and PVD negative eyes look very similar at both 5 and 16 decibels. Conversely, the dynamic longitudinal scan here in the nasal quadrant shows some movements in the vitreous, and this is accentuated at 16 decibels compared to 5 decibels. The Absolute 20 MHz probe has a vitreous-specific setting, which provides a higher resolution of the mobile membrane. So here in this PVD positive eye, you see this echoic membrane that moves with eye movements, representing the posterior vitreous. Focusing on the optic disc, there is no attachment of this membrane seen, thus confirming a PVD. Additionally, in this particular case, we identify an operculated tear with the operculum moving with the posterior vitreous. When following the echoic membrane to the far periphery, you can identify there is residual posterior vitreous attachment to the retina. Finally, these are the respective OCT scans of the PVD positive and PVD negative participants, whose ultrasound scans are demonstrated on in this video.